Let's talk to Nigeria's Chief of Health for the United Nations Children's Fund, Dr. Eduardo Celades. He joins me live from Abuja. Walk us through what precisely the role of UNICEF is in all of this. Is this in any way affiliated to the recently launched integrated vaccination program we talked about earlier?
Thank you. Thank you very much for inviting us tonight to be in your program, UNICEF. So actually today is a great day because we're introducing rotavirus vaccine. Every day, almost 2,000 children die here in Nigeria, for most of them for preventable diseases. And having rotavirus vaccine is going to save lives. We estimate up to 150 per day. We as UNICEF, we have contributed to bring the vaccines into the country. So at this moment, we have 3.8 million vaccines available already in Nigeria. And from now up to the end of the year, we'll have more than 18 million doses of rotavirus vaccine. And all of them now are available in the Northwest, North Central, Northeast, and FCT. So you can get your vaccination for your children under 1 for free in any public health facility starting today.
Do you have a targeted number of Nigerian children in mind, and how sustainable is this program?
So we aim to vaccinate to all the birth cohort that we have here in Nigeria, between 7 to 8 million children per year. As I said, we are starting in August in the Northwest, North Central, and Northeast, and FCT, and in September as well, children from the South Central, South, and Southeast, and Southwest, they will have access to the vaccine. This is, of course, a big effort that the partners in the country are doing to make this available, but we think it's worthy. We really think that this can avert many lives, up to 600,000 lives globally, and many of them here in Nigeria. So we really believe that if we have a strong system and a continued commitment, the effort will be worthy.
What have you identified as some of the challenges and factors against immunization programs like this in Nigeria? What would you advise and would you be advising the government to do differently this time?
So last week, we got the last survey results from the mixed results were published last week. And what we saw is like Nigeria has increased the coverage of Penta 3 vaccine from 50% to 57% in the last 3 years. This is good, this is progress, but it's not really enough to really be able to achieve the Sustainable Development Goals. So what we believe that we need to do at this moment is to catch up and to restore and to recover the gains that we didn't have during COVID-19 pandemic times. And once we got that, to accelerate to really be able to achieve the targets. So what I am seeing in the next few months and next year is to accelerate our vaccination campaigns and put in intensification of vaccination, but as well to strengthening primary health care. The only way that we have to deliver vaccines to the children that they need is if we have human resources in place, if we have strong data, if we have like a good supply chain system, if we have a good demand from services. So this is really what we believe that the government with partners we need to be doing over the next 18 months.
How should parents brace up, particularly post-vaccination? Are there mild symptoms to look out for? And is this a case where once you take the vaccines, then there's not going to be future cases of severe diarrhea?
Right. So this vaccine, children, they need to take it 3 times, right? At 6 weeks, at 10 weeks, and at 14 weeks. Anytime before the 1-year-old, they can get it if they didn't, because we're introducing it now. Side effects are possible, but they are going to be mild, like some fever, etc. This is going to be really, no one is going to pass or to die. This is a vaccine that is well tested, that we know that works, that we know that saves lives. So my advice is like, go with your baby, go to the nearest health facility to get the vaccine for free. This is a vaccine that in other countries like in the Europe or the US or before today was costing up to $100. Now we can get it for free. And as well, in some of the states in the north, we are supporting the government to do outreach. So basically to have mobile teams that they are able to go to the communities offering the vaccine. It's a drop, it's easy, it's not harmful for the baby. So it's really a very good opportunity to prevent diarrhea in your children.
Dr. Eduardo Celades is Nigeria's Chief of Health for the United Nations Children's Fund. Thank you for talking to us tonight.
Thank you very much.